The spleen is situated in the left upper quadrant of the abdomen, well protected by the rib cage. The spleen lays parallel to the tenth rib on the left side, is beneath the diaphragm, and its medial face faces towards the stomach. Posterior to the spleen, we find the cranial pole of the left kidney. In the hilum of the spleen, we find the tail of the pancreas. So when we perform an ultrasound scan on the spleen, we place the probe in an intercostal space on the left side, glide the transducer anterior and posterior to find the tissue of the spleen. Once we get a glimpse on the spleen, we rotate the probe to enlarge the diameter of the organ on our screen. Maybe we have to tilt the probe a little down or upwards. As with every other organ, we send the ultrasonic beam through all the tissue and find out the size of the organ, its echogenicity, we exclude lesions and observe the surrounding area. What are the normal findings in an ultrasound of the spleen? The organ is up to 11 centimeters long, up to 4 centimeters wide and 7 centimeters thick, which we can only measure in the second plane when we do a cross scan. While an unusually small spleen rarely indicates a disorder, an enlarged spleen is often indicative of a serious primary disease. When we look for the echogenicity, it's brighter, so hyperechoic to the liver. It's semilunar or triangular in shape, and the weight is up to 150 grams. We look on the ultrasound clip, and I can identify the homogeneous echogenicity of the spleen over here. Here we find the vessels entering and leaving the organ. So this is the correct position for our measurements. In this area we can detect the left kidney, parts of the diaphragm, and over here we can see the tail of the pancreas. Let's go for some real scanning. We go on with the scan of the spleen. The procedure to find the spleen is quite similar to the procedure we use to find the left kidney. So the probe is placed in an intercostal space, and after we scanned the left kidney, we elevate the transducer one intercostal space and maybe another one to find the spleen. Over there we tilt the probe to get the best image of this triangular organ with a quite homogeneous echogenicity, which is slightly higher than the one of the liver. So over here we can identify splenic tissue. And now we have to manage to find a plane where we can see the hilum of the spleen, where the vessels enter the organ. We do this by rotating the probe slightly clockwise or anti-clockwise and getting this image over here. So this is the plane where we perform the measurement of this organ. So we are taking the length of the spleen, which should be 11 to 12 centimeters. In this particular case, there are 13 centimeters, and 90 degrees to the first measurement. We make the second one. The measurement of the width should be between 4 to 5 centimeters, which is quite okay in this particular case. The third diameter is taken when we rotate the probe 90 degrees anti-clockwise. We can perform the third measurement in this plane, which should not exceed 7 centimeters. It's 7.5. When we scan the whole organ, there are no focal lesions. Size is okay. So it's a healthy spleen. What are the structures we can identify? I've already shown you the left kidney over here, which is in contact with the spleen. Sometimes we can improve the picture when the patient is taking a deep breath. Please take a deep breath, hold the breath for a while. So you can see the parenchyma of the kidney over here and of the spleen over here. There is no free fluid in between kidney and spleen. Another structure we can identify is the diaphragm. Please take a deep breath once again, which is this hyperechoic line over here, cranial to the spleen. If the size of the organ is more than 11 by 5 centimeters, the spleen is enlarged. If it is less than 16 centimeters, it's only slightly enlarged. If it's between 16 and 20, it's a moderate splenomegaly, and if it's more than 20 centimeters, it's a serious form. The causes of an enlarged spleen may be disorders of the blood circulation, diseases where erythrocytes are destroyed, infectious diseases, as well as malignant conditions. For infections, they may be caused by either bacteria, virus, or parasites. Infections with Epstein-Barr virus are frequently found with young persons and children. This infection leads to a massive enlarged spleen with the inherited danger of spontaneous rupture. In such a case, it's necessary to order rest and abstination from sport activities until the organ is back to its normal size. So a typical example for an enlarged organ. This young 17-year-old schoolgirl was diagnosed to have gallstones, and she had pains in the left upper abdomen. The spleen is more than 15 centimeters large and has rounded edges. This is an unusual constellation and indicates that there is a hematologic disease. In this particular example, spherocytosis was diagnosed with an increased destruction of erythrocytes, which lead to gallstones and an enlarged spleen. It's important, before splenectomy is performed, it's necessary to vaccinate against certain bacteria and to inform the patient that after the operation there will be some degree of immune deficiency. Let's see some other reasons for a massive enlarged spleen. In this case, we see a patient with myelofibrosis. The spleen is 24 versus 8 centimeters large. And we see this massive dilated splenic vein over here. You can see this tiny kidney over there. The spleen is 4 times larger than the left kidney. And on the next screen, we see this very intensive vascularization of this quite huge spleen with myelofibrosis. The thrombosis of the splenic vein is another reason for an enlarged spleen. What are frequent findings dealing with the spleen? Very often we find an accessory spleen. This mass has the same echogenicity as the spleen. Usually this lesion is situated near the area of the vessels leaving the spleen, but it may also be lateral. And if an exact diagnosis is not possible, it is recommended to perform an examination with a contrast agent. For example, a contrast-enhanced ultrasound. So let's see in these cases. There are these round-shaped structures near the splenic vein. There is the same echogenicity like the spleen, and we can use contrast-enhanced ultrasound if it's not so clear. Also in this example, a small lesion over here, and we should not mix it up with a lymph node. It's accessory spleen. Also in the clip, we can easily detect this round-shaped little tumor near the spleen and with the same texture than we see over here in the parenchyma of the spleen. Sometimes we can diagnose infarction of the spleen. Initially, the parenchyma does not change. Later on, it became slightly hypoechoic or even cystic in the area of the infarction. When we can detect vessels, the lack of a color signal can be a sign of infarction. Later on, a triangular shape that reaches the surface of the spleen is typical for an infarction of the spleen. Symptoms can be mild to severe pain and temperature. So in this picture, we initially don't see any change in the parenchyma. But when we use a contrast agent, it's quite simple to make the diagnosis of an infarction when we see these typical triangular lack of contrast agent. Now in this region we can easily detect the infarction because there is a triangular lack of contrast agent. It is very important to detect signs of bleeding and laceration of the spleen. Especially in the case of a blunt abdominal trauma on the left side of the body, injuries to the spleen frequently occur. Lacerations and bleeding may lead to the surface of the organ, bursting the capsula after some delay, and the bleeding may be so serious or even fatal. For this reason, an examination of the spleen in the emergency room is absolutely essential. Other causes of a spontaneous rupture and spontaneous bleeding are hematologic diseases or in some cases infectious diseases like the Epstein-Barr virus infection. Sonographic findings of an injury of the spleen are free fluid and inhomogeneous areas in the parenchyma. So in this case we see these hypoechoic, nearly anechoic areas surrounding the parenchyma, free fluid over here, and also free fluid in this area. When we go on scanning, we can detect a hematoma nearby the spleen. And in the next video clip, we can also see an increasing area with hypo and hyperechoic texture and some free fluid indicating coagula after bleeding. In this picture we can see a hematoma in this area. When we use a contrast agent, it is possible to differentiate between the splenic tissue over here and the hematoma in this area.